Hello, I'm Jamie Gossett,
And I'm Dr. Gossett.
and we're here today to talk to you about neuropathy. We've been treating neuropathy successfully in our practice here for over 10 years, and we want to share with you more about what are the secrets to correcting your neuropathy in a non-drug and non-surgical way. I was thinking about Dan Schmidt the other day, and he was one of our neuropathy patients.
Right.
Can you tell us a little bit about Dan and what happened with him?
Okay. This is a gentleman who is a carpenter and probably in his late 50s, early 60s. He was having problems with numbness and tingling and weakness in his legs and feet, and also some numbness in his fingertips. He was concerned because on site they have to walk around over boards and around and through things, and he would have to carry things, and sometimes with people as well as by himself, and he was having trouble keeping his balance and able to carry things without tripping and falling.
Right.
He was also having difficulty climbing ladders and standing on ladders, and a lot of difficulty walking up and down stairs. So he was concerned, am I going to be able to continue to be a carpenter? And he needed to work another 3, 4, or 5 years before he wanted to retire.
Right. And he really enjoyed working and he didn't want to quit, but it was getting to a situation where it was maybe going to be dangerous for him. And he certainly wasn't enjoying his life outside of working either.
Right.
It was kind of having him on the sidelines.
Exactly.
And so he found us through some advertising that we did, and then he came in and tell us about how things turned out for Dan.
So I did an exam on him and recommended some treatment because I was able to uncover what I thought was the cause of his neuropathy. And as a result of going through the program, the numbness is almost completely gone out of his fingertips. It's gone out of his feet. He has the strength back in his feet, and he has endurance now that he can work all day and not have to rest. He can walk up and down stairs without holding onto the walls. He's able to work on ladders without losing his balance and help carry things without, again, looking at his feet to keep himself from tripping. So he's very happy that he's able to continue to work and not worry about each day, am I going to fall, am I going to hurt myself?
Right. And you can find Dan's testimony on our YouTube channel. So in other words, you don't have to take our word for it. You can listen to Dan in his own words tell about his experience here along with lots of other patients. And so Dan is just really one of many, many, many people over the years that we've been able to shift their neuropathy. And so let's talk a little bit about our approach and how you're a little bit different than probably anybody that's watching has really run into as far as physicians. And I know it all starts with the exam.
Right. Based on 3 pillars of health, your structure, a person's neurology, and their internal body chemistry. These 3 things together are what make up the pillars of a normal, healthy person. If there's a breakdown in any or a combination of those 3, then the health starts to break down and symptoms, chronic symptoms begin and chronic conditions develop. So what I did was initially a preliminary exam and found that his posture was off, and did a basic chiropractic evaluation, found that he had several alignment problems in his lumbar spine or lower back and in his cervical spine or neck area, and then went on with some further orthopedic testing for range of motion and reflexes and muscle strength, and found some problems there. And the structure, the spine, the skull and the spine protect the brain, and which is the nervous system, and the spinal cord and the nerve roots. So if there's a problem with structure, and especially if it becomes chronic, it can affect the nervous system.
Yes. I've talked to literally thousands of people over the years that I've been working in the office here with you, Dr. Gossett, and I am always really shocked that a lot of people do not take into consideration, even other professionals, the orthopedic piece of neuropathy. I know a lot of people who can't feel their feet all the way up to their knees, and no one has even considered any degeneration in their spine, done any diagnostic testing or anything to see if there was anything going on there. And so that is something
It's
that's
often
the
overlooked.
first. Yeah, it is. It's very it's amazing how those can connections are not made. So that's orthopedically. Then neurologically?
So let's say if a person does have structural problems and they are chronic, maybe perhaps due to an accident or injury that they'd had 10, 15, 20 years ago, and there's degeneration that's set up, then if that irritates the nervous system, then the nervous system stops functioning correctly. So what I do is check sensitivity, sense of vibration, sense of sharp versus dull, the body's balance and coordination, because once, if the feet are not getting the right nerve supply, then the nerve endings aren't functioning normally, and then that affects the brain function with your balance and coordination and proprioception, or where your body is in space. So we test that too. And so if there's a problem there, then that's uncovered. Then the last thing is looking at their internal body chemistry, and internal medicine is what we normally call that. And if there's a problem in the body chemistry, then the most common thing that occurs is some inflammation. And that's like throwing the gasoline on fire of these other conditions. So it's important to look at a person from the structural standpoint, a neurological, which is the control of the body, and then the chemistry, which communicates as well and delivers oxygen and nutrients and should be low in inflammation.
Mm-hmm. And so then once you've done an exam and you've determined that you can help the person because you've gotten to the root cause of what's going on with them, tell me a little bit about how we're unique as far as what treatments that we do to help, reverse some of this, or in most all conditions significantly improve things.
Sure. So the first thing that we work to do is to stabilize the structure. If that's unstable, nothing else is going to help unless you have a foundation of a good, solid structure. And the treatment is broken up into phases. Phase one is to stabilize the structure and begin taking the pressure off the nervous system, and begin with looking at your diet, making sure that you're not taking foods and fluids in that are inflammatory in nature, to reduce your overall pain level. Once that's under control, then phase two is more of a rehabilitation phase, similar to if you have heart surgery, you have heart rehab. If you have orthopedic surgery, you have orthopedic rehab. So we do rehab also. First of all, stabilize everything and then work on rehabilitating it. So with the structure, we're looking at getting better flexibility and strength in the muscles, the flexibilities in the joints, strengths in the muscles, and then reactivating the nervous system. And many of the therapies we use work at a cellular level to stimulate the healing process and really accelerate the healing.
Right. So in the stabilization phase, just quickly, if you would just run down some of the therapies that we do that are cutting edge that you use to accomplish that.
So I've had extensive postgraduate training in orthopedics, neurology, and internal medicine. So as a result, I use a lot of procedures and techniques that are relatively new, that other doctors aren't aware of, much less utilize. And this involves oftentimes buying new equipment, which is very expensive, yes, and which nobody else has available. So, and there are mimic types of therapies out there that I'll be mentioning that you will have heard about before. It's important to make sure that you're getting the real deal with these medical procedure and equipment, so that you get the best results. So, and looking at the stabilization phase, we're looking at, first of all, realigning any structural fault or misalignment that's there. Then working, what often happens in the spine is a compression component. And that can lead to degenerative disc disease, that can lead to herniated or bulging discs, it can lead to stenosis, and those kinds of things result in all kinds of different symptomatic conditions that have lots of different names. At this phase, what we do is work with a non-surgical spinal decompression unit. Now, there are a lot of units out there, but there are only 2 on the market that are actually true decompression. They're digitized, computerized traction that works with your body. Traditional traction, when there's traction or a long axis pull, as soon as there's movement between 2 vertebrae, there are 16 to 18 muscles that hold each vertebra together and allow it to move a little bit. those muscles go into an immediate contraction to protect it so that it doesn't cause injury. Well, in this situation, traditional traction, as soon as that happens and the spasm occurs, no decompression is really occurring. With these new decompression units, what happens is as there's an opening of the space, the disc space and the joint space in the back part of the spine, those muscles tense up, the traction stops, goes back to half, and then pulls again and back to half, and again and again, and it works with muscles to actually create that decompression that will open up that disc space, pull the disc back to its normal position, and then stretch out the muscles, break down scar tissue, and start the healing process.
Right. And we have had a lot of patients that have had spinal decompression before. I mean, that is advertised, it's at other places, but they have failed that treatment because either the table was not the correct table to do the work, or in some cases the practitioner doesn't know how to fully utilize like you do to get the most out of it. The other thing that's sort of unique about us that I don't see out in the market anywhere is Dr. Gossett is very hands-on, and he is evaluating you on every visit to see if your program needs to be tweaked just a little bit. And it's those small incremental changes that really do the heavy lifting to get people better.
Right. So the therapist and I are in the room most of the time that you're on therapies. And during this time, we're one-on-one with you, working, and each day we use that therapy just a little differently as your condition will improve and as it changes. If it changes for the good or the bad, we make the adjustment to gradually make an improvement in your condition and go forward.
Right. So what are the therapies?
Other therapies would be rapid release type of therapy. The adjusting procedures I use are with instruments that are low force and high accuracy.
Mm-hmm.
So the last thing a person with degeneration needs is somebody in there manually moving their joints.
Mm-hmm.
You need a precise, light movement to reset things and reset those reflexes, and then the body takes that and accepts that. After that, the rapid release is a high intensity vibration device that we use to relax the muscle spasm that's there and to break down scar tissue that's developed through the years. After that, then we use something called infrared heat. Now this is a deep heat that's the most effective type of heat that's available today to go into the muscles and the joints and the nerves to start the healing process. It increases circulation there to break things down and stimulate the healing process. After that, then we use the decompression, and that again decompresses the discs and the joint spacing. It stretches out those muscles gently. It works with the muscles, not against them, as we were talking about before. And then after that, we also use some electrical stimulation to help either reduce the patient's pain or to start to stimulate those nerves or nerve endings to wake them up and get them working again correctly, to reset them at a cellular level. Then after that, we use something called a wobble board, and the wobble board is used to exercise the brain and reset the brain to this new posture and this new positioning, so that when you leave the clinic, the brain sticks with what we've done rather than saying, oh, well, that was nice while you were there, but we're going to go back to our old habits. So it resets and locks it in. The last thing we do is intersegmental traction. That's a device you lay on your back, and it has a rolling device that moves up and down the spine. So what that does is put normal motion back into each segment and has a massaging effect on the muscles.
Right.
So most patients are pretty relaxed by the time they leave.
Yeah, I mean, it sounds like a lot, and sometimes when people hear about it, they get kind of overwhelmed, like, well, I'm not in that great a condition right now, and I don't know if I can hold up to all that, but most of this is done passively, and a lot of people even fall asleep. So it's very relaxing. Yeah.
And the patient relaxes.
Yeah. Yeah.
Oftentimes they fall asleep.
So run down quickly through the rehab process and what people get when they're in.
Sure.
And that's a big piece that is missing in a lot of spinal decompression programs.
Yes. A lot of decompression programs just focus on the decompression and nothing after that. Well, after getting a patient stable, the structure stable, then we need to reteach the body how to use it properly. And so we do some specific types of spinal stretching techniques and then exercise techniques that are very easy to do right here at the office with our supervision, and we still use some of these other passive therapies as well.
Right. The Nerve Smart, for example.
Yes, we continue to use the Nerve Smart to stimulate those nerve endings in the hands and in the feet, and spine if that's involved, to regenerate those and get them up and running, rebooting them, essentially, rebooting your nervous system.
The Nerve Smart is a very expensive piece of equipment that we invested in to bring to the community, and it is really a game changer when it comes to neuropathy.
Yes. What's unique about us is the expensive decompression unit, the Nerve Smart, and then we also use something called PEMF. It's pulsed electromagnetic frequency treatment. So it's using an electromagnetic current to run through those soft tissues to stimulate at a cellular level, and what that does is that stimulates the healing process again and accelerates the healing and maximizes it.
Right.
So those are three things that are unique, as well as the adjusting procedures that I use are unique.
Right. So we've given you a lot of information, but information doesn't create transformation. I used to have a boss that said, when managing people, it says, he used to say, people don't change when they see the light. They change when they feel the heat. And so what happens is you may be in a position where you're feeling the heat, that you may be in a position where you're losing a lot of your freedom. I mean, this is why we do this, because people get to a certain age, they've worked really hard, they've saved their money, they've done everything right that they thought they should do, their children are raised, they want to have fun with the grandkids, they want to go do things, and as it's turning out, they're in a ton of pain. They can't walk, they're starting to use assistive devices. And you know, that's the stake in the ground that we've put. We are going to help these people, right?
Yes, at the age of 14, I decided this was what I wanted to do. And 50 years later, that burning desire still is there. And I'm reaching out to help those who have been elsewhere and have tried and are still having problems. And those are the patients we focus on, and those are the patients that we're able to make a transition or a transformation in their life, if they're willing to make the commitments. Now, you do have commitments of time, money, and
energy.
Yeah. Yes.
Yeah, for sure. So I hope this resonates with you, and I hope you learn something and you can see what we're all about. And if you are in need and you've been thinking about it, I just recently talked to someone who came into the office and they watch us on YouTube for 2 years. I'm like, 2 years? Don't let that be you. You see it now. Now's the time to act, and we hope to hear from you very soon. You take care.
So if you're sitting there on the couch, you need to take the action to give us a call, talk with Jamie or Susan, and let them know what your situation is to see if it's possible for us to help you.
Yes. Take care.